It began on a Tuesday afternoon in March, in the middle of a history class, when a 15-year-old boy named Daniel started laughing. Not the suppressed, seat-shaking laughter of a teenager trying not to get caught. Something else. Something that didn't stop when the teacher looked at him. Something that didn't stop when he was sent to the hallway. Something that was still happening 2 hours later in the school nurse's office, while he sat on a vinyl chair and could not explain what was funny. Nothing was funny. He knew nothing was funny. He could see the nurse's concern, could hear the edge in his mother's voice when she arrived to collect him. He understood the situation completely. He simply could not stop. The laughter continued through dinner, through the night, through the next morning, when his mother drove him to the emergency room. It would continue in waves for 22 more days. Daniel was 15 years old, a sophomore at a public high school in a suburb of Columbus, Ohio. He was, by every account that mattered, a normal kid. Average grades, a small group of close friends. He played video games on the weekends, complained about homework, and had never before the Tuesday afternoon in March given his parents or his teachers or his doctors any reason to be concerned. He was not a particularly happy child in the way some children are. Easily delighted, quick to smile. He was more reserved than that, thoughtful, the kind of teenager who chose his words carefully and laughed only when something actually struck him as funny, which made what happened harder to understand. His mother noticed the first signs on the Monday evening before, though she did not recognize them as signs. He seemed distracted at dinner. He smiled at something she said that had not been intended to be funny, and when she asked him about it, he said he wasn't sure why. He went to bed earlier than usual. The next afternoon, the calls began. By the time she brought him to the emergency room on the second morning, he had been laughing, intermittently but persistently, for nearly 18 hours. The ER physician examined him. He ordered blood work, a basic neurological assessment, a CT scan. He found nothing. His working diagnosis was a psychological episode, stress-induced. Daniel was referred for outpatient psychiatric evaluation and sent home. The psychiatric evaluation found nothing. The psychologist spent 2 sessions with Daniel, who was cooperative, articulate, and fully aware that his laughter was not a response to anything he found amusing. He described it as something that came from outside him, like a sound being played through his body without his permission. He was referred back to the ER when the laughter entered its second week. A different physician this time. She ordered a longer panel of blood work, a repeat CT scan, and, at Daniel's mother's insistence, a referral to a pediatric neurologist. The pediatric neurologist examined Daniel on a Thursday morning in the 3rd week of the episode. She watched him. She asked him to describe the sensation from the beginning. She asked about the school day before it started, about sleep, about anything that had seemed different in the days leading up to that Tuesday afternoon. Daniel mentioned, almost in passing, that he had been sick about 3 weeks before the laughter began. A bad cold, he thought. Sore throat, fever, fatigue. It had lasted about a week. His mother had not taken him to the doctor for it. It had seemed like a straightforward respiratory illness. The neurologist asked about the sore throat specifically. She asked whether it had been tested for strep. It had not. Daniel's mother had assumed it was viral. The neurologist ordered a blood panel that no previous physician had requested. It tested for antibodies to a specific bacterial protein, the kind produced in response to a streptococcal infection. She also ordered an EEG, looking at the electrical activity of Daniel's brain during one of his laughing episodes. The blood panel came back positive for elevated strep antibodies. The EEG showed abnormal activity originating in the hypothalamus, a small structure deep in the brain involved in regulating emotion, among many other things. The activity was not a seizure in the traditional sense, but it was structured and repetitive in a way that matched a specific pattern the neurologist had seen documented in the literature, though never in her own practice. It was called Gelastic epilepsy, from the Greek word for laughter, a rare form of seizure disorder in which the abnormal electrical discharge produces involuntary laughter, not as a symptom of emotion, but as a direct neurological output, disconnected entirely from what the patient is actually feeling. In Daniel's case, the trigger appeared to be an immune response to the streptococcal infection. The antibodies his body had produced to fight the bacteria had, in a mechanism that remains poorly understood, crossed into his central nervous system and disrupted the regulatory function of the hypothalamus. His immune system had attacked the infection, and in doing so, had accidentally attacked part of his brain. It was a process with a name too: autoimmune encephalitis, triggered by streptococcal infection, producing a form of gelastic seizure activity. The formal diagnostic framework was still being developed at the time of Daniel's case, but the pieces existed in the literature for a physician willing to look for them. His neurologist looked. She sat down with Daniel and his mother and explained what had happened. She described the strep infection, the antibody response, the hypothalamus, the electrical misfiring that produced the laughter. She told them it had a treatment, a course of immunotherapy that could reduce the antibody load and allow the hypothalamus to stabilize. Daniel's mother asked how this could have been missed for 3 weeks. The neurologist said, "Because it looks like nothing we are trained to look for first. It looks like a psychological episode, and the connection to a strep infection that happened a month earlier, that connection is not in the standard checklist." Daniel began immunotherapy the following week. The laughing episodes reduced in frequency within 10 days. By the end of the treatment course, they had stopped. He returned to school 6 weeks after the episode began. His friends had been told he had been ill. Most of them did not ask further questions. He went on to graduate, to attend university, to live a life that was, in the years that followed, unremarkable in the best possible sense. He experienced no recurrence, but he kept the EEG printout, the one that showed the abnormal discharge in the hypothalamus, the electrical trace of the 3 weeks when his body had turned against itself, and expressed the result as laughter. He kept it not as a reminder of something frightening, but because it was the first piece of paper that told him the truth, that nothing had been funny, that he had known that the entire time, and that the laughter had been real, and the cause had been real, and neither of those things had needed to wait 3 weeks to be believed. Gelastic epilepsy remains one of the most underdiagnosed seizure presentations in pediatric neurology. Its mimicry of psychological symptoms, combined with the often delayed connection to a preceding infection, means that the average time from onset to correct diagnosis is measured in weeks or months rather than hours or days. For the patients living inside those weeks, the experience is precise and strange in equal measure. They are not laughing because something is funny. They are fully aware that nothing is funny. They are observers of their own bodies doing something their minds did not authorize. The laughter, in the end, is the least of it. What stays is the memory of being told it was psychological, of being in a room with a professional whose job was to find the answer, and being sent home with the wrong one. Daniel remembered the nurse's office on the first day, the vinyl chair, the way the nurse had looked at him with an expression that sat somewhere between concern and something else he had not been able to name at the time. He was older before he found the word for it: doubt.